Hi, I'm Dr. Joe Nemeth. I am a periodontist in Southfield, Michigan, and I want to talk a little bit today about gummy smiles. So when you smile, you may have too much gum showing. Sometimes it's called a horsey smile. And I get a lot of patients who have this horsey smile, and they're kind of embarrassed when they smile. They put their hand over their mouth, and they're just really not comfortable. So this was a recent example. This young lady came to me, and she had had orthodontic treatment very frequently after orthodontics. The gums get irritated and become swollen. Sometimes they go back to their normal shape, sometimes they don't. At any rate, this young lady was embarrassed with her smile. You can see that these teeth are short, and so we reshaped the gum tissue. We sculpted the gum tissue to give her a more pleasing smile, and you can't see now her lip covers it, but her lip didn't cover her smile before, and we've lengthened these teeth, and I think we got a very beautiful result. So this is what it looked like before, and this is what it looks like now. And she's thrilled, delighted, and very pleased, and therefore I'm also thrilled, delighted, and very pleased. I love making these people happier. They're no longer afraid to smile. It changes their life. Here's another gentleman, again, just in recently, and when he smiled, he didn't smile. Why didn't he smile? You can see. So he was really embarrassed to smile because that gum tissue was just covering these teeth, and it was very anesthetic. So we did the reshaping of the gum tissue, eliminated that gummy smile. This is what he looked like afterward. This tooth was chipped. It was chipped before, it was chipped afterward. And once he gets that chip repaired, I think his smile will be beautiful. But here's a close-up. This is what it looked like before. This is what it looks like now. There's that little chip that he needs to get repaired. And he's going to look like the man that he should be looking like. I have done many hundreds of these, probably close to 1,000. It's one of my favorite procedures because it's so visible and changes the life of these patients in such a meaningful way. And it's so gratifying to me to be able to do that, and of course to them. And this is a young lady we did a while back. She actually was in dental school, and this is her before, this is her after. And we love doing this because it makes a difference in the lives of these people. I had one lady who was a flight attendant. I guess that's what they're called now. She was a flight attendant, and she was embarrassed to smile. She was very beautiful, embarrassed to smile. We changed the smile to the point where she broke down in tears afterwards. She was so grateful and so very pleased. And you know, it's interesting because there are a number of famous people, as I had mentioned in a previous YouTube video, a couple of celebrities, and we picked a couple of those out. This is Gwen Stefani. You can see her smile. It's a very gummy smile. She had crown lengthening done. She may have also had lip lowering, and sometimes we do that to bring the lip down so it can't pull up as far. And with a combination of crown lengthening to have more of the tooth showing and less of the gum, and the lip lowering, which tends to fill out the lip and make it more attractive, and she ended up with a beautiful smile and a wonderful career. It takes an hour or two depending on what's involved, but almost always it's not just the gum. Actually, usually the bone underneath has to be reshaped because the gum follows the bone, and if you just reshape the gum but you don't reshape the bone, that gum is going to grow back. So it's not quite as easy as a lot of people think where you just trim the gum. No, the gum has to be sculpted, but the underlying bone has to also be sculpted to get the result permanent. Otherwise, that tissue is likely to grow back and have a gummy smile again. Here's Nicole Kidman. I've always had a crush on Nicole Kidman. At any rate, you can see what her smile looked like before. Her lip kind of pulled up to the left, and a lot of gum tissue showed. She had some crown lengthening done because if you look at these teeth, the teeth are a bit longer than they are here, And she may have also had some lip lowering done to correct the lip pulling to the left. And it's a great procedure. It's just a great procedure. Sometimes we do a whole mouth. Sometimes we just do certain teeth where the gum may be lower than the other teeth in order to even up that smile. So people no longer are embarrassed, and they're proud to smile. It's like being freed from smile prison, and they can smile again. There's virtually no risk associated with the surgery. There's usually very little pain or very little discomfort afterward. There's a healing period of a couple of weeks, and the results that I have seen, I can't think of one case where the patient hasn't been absolutely pleased and sometimes shocked at how much more wonderfully the tissues appear and the smile is than it was before. So just remember, we do that. If you have a problem, we're happy to take a look at you. But most importantly, keep your mouth healthy. If it's not healthy, you're not healthy. Healthy mouth, healthier body. Contact us, questions, comments, subscribe to our YouTube channel. Love to hear from you. Have a good day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.